We need a new office for global risk preparedness. The lack of global preparedness and slow response to COVID-19 is a case study of the problems that follow from being inattentive to radical uncertainty. Something denied and not well studied in academia and poorly understood among policymakers. COVID-19, in fact, and its preparedness and policymaking around it is a paradigm case of decision-making under uncertainty and its difficulties. We don't know about the virus, how it will spread and mutate, whether it will respond to treatment or vaccination, etc. And that's only a start. There's also conflict about our goals and the effectiveness and consequences of the actions we contemplate in trying to prepare for our ordeal with it. Do we minimize deaths from COVID-19 at the expense of other conditions and the economy? And at what time horizons and cost? It's a clear example then of a situation where the range of possible actions and the probabilities of possible outcomes are not known or even not yet imagined, and where quantified knowledge of costs and consequences is not known or contested, but policymakers must still act. What is the hard task about radical uncertainty is to realize that there is no agreed best solution. In fact, it's very hard to accept that if deciding how to prevent things ahead of time, when the default temptation is to ignore it, when there are penalties for failure, there are uncertain rewards for success. It's pretty hard to accept it when it is actually happening, but of course easy to be wise afterwards or in model land when you won't be responsible. Conviction narrative theory, which has been elaborated with my colleagues from Cruz, formulates decision-making for real-world, radically uncertain contexts. The central idea is that narratives, not probabilities, are the currency for knowing. Constructing narratives for ourselves is how we get to know things, in other words. Conviction narratives do what in radical uncertainty probabilities cannot. They provide an emotionally and socially validated sense of what will work, although we can't really know. Looked at from the C&T perspective, in COVID-19, the chosen policy response is the one based on the narrative which policymakers think as well as feel to be the most convincing. Convincing to them, to those who must carry it out, and to the public. Now, narratives do four things to support decision-making by creating conviction. First, they make sense of the disparate information that policymakers have available. They put it into a story. Second, they allow policymakers to use mental time travel to simulate the outcomes of different actions and to select a preferred strategy. They create, thirdly, felt conviction, and this is crucial. This is because narratives are embodied, because thought is an extension of basic brain capacity for forward-looking assessment of well-being. Consequently, a narrative can create, or not, a realistic feeling that a plan will work. And then finally, of course, narratives facilitate communication and coordination, which in this case is very important. Now, the point about decisions made in radical uncertainty is that they're very likely to be wrong and force U-turns. Things change. Making such decisions then provokes fears of failure and humiliation, but perhaps opportunities for triumph and enhanced reputation. In other words, radical uncertainty necessarily creates ambivalence, the uncomfortable emotional and cognitive state of being pulled in two directions at once, potentially provoking manic action or paralysis. Conviction narrative theory highlights how policy choice manages ambivalence by drawing on a narrative which makes the selected action attractive so that it can be thought and felt to be right. A good or effective policy narrative recognizes what we know and don't know. It is evolved in an inquiring and alert state, looking out for surprises and the unexpected. This state requires anxiety and not knowing to be tolerated. I call it an integrated state. A policy, on the other hand, has evolved in a divided state when the narrative is crafted by leaving out things that create anxiety and difficulty. It is facilitated via organizational, intellectual, or emotional siloing, particularly by inattention to radical uncertainty, that is, to what is not known. COVID policymaking appears to have been captured by a divided state. A pandemic and its potential to kill millions of lives and devastate the economy and social life was at the top, for example, of the UK's risk register, and was and will remain so here and in other countries. But the effectiveness of preparation for this known risk was undermined by ignoring the implications of radical uncertainty. There was a capture in the thinking beforehand by a central case, by one way of thinking about things where they thought it would be like flu, which is not unreasonable since flu had been the kind of thing we had to prepare for the last 100 years. It wasn't the only thing. So other alternatives became a problem. Capture by optimization, as in, for example, cost-benefit analysis from economics, or in risk modeling, or in the way supply chains were thought of. So we found there were problems with testing capacity, which wasn't available and had to be built up very quickly when everyone else was trying to do it. With PPE, with beds, intensive care beds, respirators, in the same way as it happened with liquidity and bank capital in 2008 during the financial crisis. The underlying problem is that people fall for the more bang for your buck mentality, which is part of economic optimization theory, by ignoring the rainy day potential of having stuff around that you're not necessarily using yet. And then there was capture by organizational and, of course, national or nationalistic silos. Health services are split from social care, public from private. There's a problem learning from other people and other countries, from other experiences. The UK didn't look at SARS, for example, as happened in Asia. We never had it. Didn't have that experience. And then there's the politicization, for example, of the WHO. All of these things creating silos. As in academia, we have classic epidemiology, model-based epidemiology, virology, clinical medicine, economics, psychology, and many other disciplines that are relevant, but all tending to work entirely on their own. In short, policy, I would argue, has emerged from a divided state. And it's an example of a more general problem of the consequences of siloing academic disciplines and siloing off academic research from real-world decision-making. Very little decision-making in academia actually applies to radically uncertain contexts, and that's the big weakness of economics too. COVID policy also illustrates capture by command and control communication, which of course is another thing which goes with a more certain world rather than uncertain. Under radical uncertainty and other forms of complexity, decision-making has to be devolved to the relevant local context. Although governments or executives make policies under radical uncertainty, it's people who carry them out, and that has to be taken into account. Supporting narratives, therefore, need to be built by negotiation and building a shared consensus of understanding, not by imposition. Failures to build consensus cause loss of reputation and control for decision makers, for governments, which is sort of what's happening, and it's very dangerous. So, a global solution proposal to finish off. Well, pandemics and similar crises requiring rapid coordinated international decision-making will happen again. This time, we were not prepared due to inattention to radical uncertainty and what I've called this divided state decision-making and not understanding. It's been very costly in life and well-being. Next time, or with similar radically uncertain risks, it could be worse. Therefore, what we need to do is to establish national and international independent offices for global risk preparedness. They should be required to consult intergenerationally and socially diverse publics as experts to help imagine the future and create incentives for prevention. They should be mandated to make annual public reports to Parliament and to the G20, and perhaps we should hold an annual public hearing at the GSS, the Global Solutions Summit. They should assess the level of preparedness via a traffic light system, assessing the presence or absence of divided state features in planning for key risks. There will be more pandemics and lots more radical uncertainty. Understanding divided states and how to create resilient knowledge for decision making, it has become apparent, is literally vital.